Welcome back to Dental Vibes. I'm Carla.
And I'm Gabby. And we have been dental assistants for over a decade now. And today we're going to talk about oral health. Especially with this pandemic going on, the dental offices closing, patients were not able to get their cleanings done. And even now with offices open back up, there's a lot of catching up to do. So a lot of patients are not going to get their cleanings immediately. And it's going to take a while for them to see the hygienist or the dentist. So today we're going to focus on how you can maintain a healthy smile at home.
So specifically for this video, we're going to focus on maintaining your gum health, okay? So if you're experiencing bleeding gums, maybe tenderness also in your gums when brushing or flossing, it could be that you have gingivitis, which is inflammation of your gums.
Yeah, and it could even be a chronic situation where you have periodontal disease. If you haven't been to a dentist in a while, you wouldn't know that.
Until you're able to get back with your hygienist, we are going to talk about a few tips of what you can do at home.
These tips that we're going to mention is kind of a rule across the board of what you should be doing at home anyway for a healthy smile. But of course, if you are having any of the symptoms that Carla mentioned earlier, then you want to pay extra attention to these tips. Okay, so first thing we're going to start is brushing. So you know we have to brush for 2 minutes. Okay, so, and we see this all the time. Okay, don't feel bad like you're the only one who doesn't know this. But whenever you are brushing, you want to make sure that each area of your mouth, you're going to angle it a certain way. Okay, so if you are having bleeding gums and gum irritation, you want to make sure you massage the gums. So here's your toothbrush. You're going to focus on the neck of your teeth. Half of the toothbrush on the teeth and the other half on the gums. So you're going to go circle motions, kind of angle it where it could get right in there, because plaque is going to hang out around your gums. Not so much over here. Right?
Or if so, that's also the easiest area.
This is the easiest area to get. So it's going to want to spend most of its time around the gums. So if you're really focusing here, but you're not focusing on your gums, even though you're brushing for 2 minutes twice a day, you're still missing those spots. When you go all the way to your back molar, especially if you have wisdom teeth, then you don't want to open super wide because there is no room for your toothbrush to get in there. You kind of almost want to close so you can stretch your cheek out of the way so you can get all the way back there. Also, there are different sizes of toothbrush, so you can get small heads, bigger heads. We always recommend soft toothbrush because you don't want to damage your enamel and you want to be able to massage your gums. So brushing is very important. Twice a day. We love electric toothbrushes, which that's a whole nother story, but any toothbrush will do as long as you're mechanically removing the plaque.
Now the second thing is flossing. We recommend that you have to floss at least once a day. You can definitely floss after every meal. If you're experiencing some of the symptoms that we talked about possibly having gingivitis, you can go ahead and do it twice a day. It's not gonna hurt. You want to be able, the goal here is to be able to remove all the plaque that is on your teeth so that your gums can get healthy again.
I mean, you can floss 50 times a day. I'm sorry, you can brush 50 times a day. But in between your teeth is still gonna be dirty. So if you're not flossing and you're only brushing, you're not removing all the bacteria from your mouth. And what a lot of patients do, or at least their thought process, is that if they floss and their gums bleed, then they're making it bleed by flossing, so they stop. Absolutely not. If you're bleeding, that means that there is bacteria there, so you need to floss more.
One of my, well, I don't know about favorite, but definitely like my go-to floss right now that I'm loving is the Reach by Listerine. It's a pretty standard floss. We got it over here.
Wax.
Wax, of course. So it's just great. I love the string because you can just get into everything, maneuver it a little bit easier. What are you using right now?
So my favorite of the moment is the Listerine as well, but it's the Johnson & Johnson, and it's kind of like a super elastic floss, which I love because if you have really tight spots in between your teeth, that floss will glide kind of in and out.
So now let's talk a little bit about different ways that we can floss. Like I said, we love the string because you can floss properly like you should be.
Hug the tooth like a C shape like you should do.
But there's also those little floss picks, which for me, and I think that you're in agreement, those are like the to-go kind of floss. So we're like traveling. I do keep them in my purse. I keep them in my car just to do like a quick thing. You know, I don't need a mirror to floss with those, but they don't bend like side to side that well, so you can't really like drag it along the gum line to remove the plaque in those areas. So I don't recommend those for the daily use, but definitely like to have it for the go.
One thing that you must use if you have braces, bridges, and a permanent retainer is a floss threader. Yeah. So it's gonna take you longer to floss. I'm sorry, that's just what it is. Yeah. But with time you will get faster. Okay, you will get faster. Yeah. So you're gonna use a floss threader. So this is what it looks like. Okay, and you're gonna put your floss through, and like you're sewing. Yeah. You're gonna get in between every tooth if you have a wire. If you have a bridge, then you're gonna go under that bridge and clean it. And if you have a permanent retainer, you're gonna go under that permanent retainer in between every single tooth and clean it. If you guys want us to show you different techniques on how to floss, the proper way to floss, let us know in the comments and we will do a separate video on that.
Yeah, because there's a lot of details that we could talk about that, so yeah.
Now, another thing that you can do if you know yourself and you know you're not gonna floss, okay? Yeah. Again, something is better than nothing. You can use a water flosser. Yeah. A water flosser is great if you know you're not gonna be flossing every day, if you have braces.
Because that's not really like replacing the floss, it's just like an add-on. But it works great for like hard to reach areas. Yep. It really definitely helps like just give you, if you have braces especially, give you like an extra rinse, an extra good rinse.
Exactly. I mean, if you have implants, you know, to angle it in there and flush things out. So the water flosser is great. Yeah. I always tell people to get one, but don't forget about the floss completely because you don't replace the floss.
And lastly, we have what they're called proxy brush, interdental brushes, and we have one little sample here. They got, this is the handle,
and then they look like little Christmas trees, just like that, and then you put it in the handle. I mean, they have different styles, but the idea is for it to look like little Christmas trees that are very flexible, and you can get into certain areas and clean it.
Sort of brushes in between. I think that this is also like the floss picks, that they're like a traveling thing because they have like the smaller ones that you don't need this long handle. But again, it's just doing certain areas. But it's definitely great also this for people that have dexterity problems or you have arthritis, so you can like grab this much easier than the little string floss. So yeah, that's just a few of our ideas. Now let's talk about a couple products that we would love to recommend to you to just kind of treat the gingivitis a little bit more. The first one is this toothpaste, Parodontax, right? And it's specifically to, you know, help treat bleeding gums. So it's really great. What has been like your main experience with this? Patients have gotten great results with it.
Patients got great results, so pretty much it will help, you know, fight off plaque, which most toothpaste will, but this one specifically, and it will help with the inflammation of the gums. So again, remember the techniques from brushing from the beginning of this video. You want to make sure that you're massaging the gums so you can get that bacteria out and you can get that inflammation down. The other thing that we have that also patients have really been liking this is the Listerine mouthwash, and it says gum therapy. So pretty much the same thing. It's going to focus on the inflammation of your gums and fight off the plaque that's accumulated, because that's why your gums are inflamed, because plaque has been hanging out there for so long and your gums get angry. Okay.
A lot of people question like whether I should really use a mouth rinse or not. I know a lot of people also like to rinse with like warm salt water. What I like about using a specific product is that it's specifically designed to kill the bacteria that is hanging out, not just on your teeth, on your gums, but the rest of your oral tissues, your tongue,
the roof of your mouth, all that.
So it's just like treating all of that, where I feel like warm salt water rinses, it's like if you have a laceration, something like that. I mean, it would help with inflammation, but
if you have maybe like one spot, then you're gonna, okay, let me do some salt water rinses.
But just like as preventative as well, like to treat everything combined, I think doing a good rinse after you brush and floss, it's great.
Of course, let's not forget your tongue. Especially for bad breath.
Yes.
Usually it's coming from the tongue, so you want to make sure that you're brushing your tongue. Either you can do the toothbrush or you can get a tongue scraper.
Yeah, that too. That's where the main bacteria settles down. If you notice that your tongue is not nice and pink, it's because there's bacteria. That white coating, that's what it is. If it's really thick, if it's very white, definitely go get a tongue scraper from the grocery store. But if you're, notice that it's okay, daily brushing, it helps too.
So I hope that all these tips were helpful. Make sure that you are seeing your dentist regularly, but we know that this time things have been really crazy on the dental world.
Yeah.
So hopefully you can get your appointment in very soon. And of course, like this video, subscribe to our channel,
hit the notification button,
and we will see you guys next time.
Keep smiling.